because we've got the Jeff Horn fight happening up in Townsville, some extra measures have been put in place by Queensland Health, and that is that Queensland Health will be greeting people coming off the flights into Townsville just to check that they have no symptoms. This is because we have a large number of people from indigenous communities that are coming to the fight. It is very important that no one goes to the Jeff Horn fight. If you have any symptoms, you must stay at home. So we're putting in this extra level of precaution just to make sure that everyone is safe at that event. And of course, I'm going to wish Jeff Horn all the very best. I'll hand over to the Deputy Premier and then the Chief Health Officer, and we're happy to take any questions. Thanks, DP.
Thank you, Premier. Well, we breathed another sigh of relief this morning to learn that there were no further cases of COVID-19 here in Queensland, although there, of course, is still a long way to go before we know we have controlled this possible outbreak. That leaves our total number of cases at 1,106. 18 of those are active. As the Premier said, we did 8,059 tests in the last 24-hour period. 6,278 of those were in the HHSs where we are concerned about the Youth Detention Centre cluster. I want to apologise to those who saw delays in getting testing, particularly at Redlands. Today we will open a further fever clinic at Gundapar in the Bayside, hopefully to relieve some of the pressure on the Redlands. I just emphasise that in terms of redeploying health resources from across the southeast, first and foremost, we've had to relieve a number of staff from the Ipswich Hospital Emergency Department who were potentially exposed there. We have also allocated significant resources to our hotel quarantine, which remain at near peak levels, and that has impacted our ability to stand up many more fever clinics, but we have extended the hours of those that are operating. The Chief Health Officer will outline in more detail early preliminary results from that genomic testing she has been talking about. Those early results indicate that the first case of the Brisbane Youth Detention Centre cluster had the same strain of COVID-19 as one of the women who travelled to Melbourne, as well as the diners at the restaurant thought to have acquired it from that person. That doesn't disprove the theory that they are related. It doesn't prove the theory either, because that strain, the B1125 strain, is the most common strain currently circulating in Victoria.